Today we will discuss about the larynx. Larynx is the Latin word which is the wind pipe, means the air pipe. It is the organ for the production of the voice, or it is called the organ for the phonation. It acts as a sphincter for the lower respiratory passage, and it is also called the voice box inside the human being. It lies into the anterior midline of the neck. It extends from C3 to the C6 vertebra. It starts from the laryngeal inlet to the laryngeal outlet. It is the extent from C3 vertebra on the posterior aspect to the C6 vertebra, and mainly the length of the larynx, it is nearly 40 to 45 mm inside the male, and 35 to 40 mm in female. So this is the length of the larynx. It is mainly formed by the cartilage, membrane, ligaments and muscles. The cartilage of the larynx, which is mainly formed by the 3 paired and 3 unpaired cartilage. Unpaired cartilage, it is the thyroid cartilage. This is the cricoid cartilage. We can see it from the front side, and from the back side you can see there is a one unpaired cartilage. It is called the arachnoid. This is the epiglottis. So unpaired cartilage are the thyroid, cricoid, as well as the epiglottis. Paired cartilage on the both side here, both the sides above to the cricoid cartilage. This is the complete encircling of the cricoid cartilage, and above to it, this cartilage, it is called the arachnoid cartilage, and above to it, this rounded shape, it is called the corniculate cartilage, and above it is there is a cuneiform cartilage. So 3 paired arachnoid on the both the sides, corniculate and cuneiform cartilage. These are the paired cartilage of the larynx. So this is about to the cartilage of the larynx. Now we will discuss about the epiglottis. It is the unpaired cartilage. This one is the epiglottis. It is the leaf-like, extend beyond to the hyoid bone and the tongue. So it is extend beyond to the tongues into the upper sides. It has a 2 end. This is the upper end, which is rounded, and the lower end, which is pointed, which is attached to the thyroid cartilage by the thyroepiglottic ligaments. Thyroepiglottic ligaments. On each side, it is called the lateral border, which is attached with the arachnoid cartilage by the aryepiglottic folds. So this is the aryepiglottic folds. So epiglottis, anteriorly it is attached with the tongue by the median glossoepiglottic fold, and on each side also attached to the tongue by the lateral glossoepiglottic fold. So this is the lateral glossoepiglottic fold, and this both are the lateral glossoepiglottic fold, and this is a median glossoepiglottic fold, and on each side there is a, in between there is a one depressed area in front of the epiglottis, and behind to the tongue it is called the vallecula. So this epiglottis, along with its aryepiglottic fold, this is the aryepiglottic fold, or it is also called the quadrate membranes, and posteriorly there is a 2 arachnoid cartilage. If we fuse it with, you can see this is the arachnoid cartilage. All these interarachnoid or transverse arachnoid or mucosal fold of the arachnoid cartilage, aryepiglottic fold, and the upper part of the epiglottis, which makes the laryngeal inlet. The laryngeal outlet, which is formed by the most lower part of the cricoid cartilage. Here you can see this is the completely encircle of the cricoid cartilage. It becomes continuous as a tracheal ring. So the laryngeal outlet, which is formed by the lower part of the cricoid cartilage, which makes the laryngeal outlet, and it becomes continuous as a tracheal ring. Basically the another cartilage, it is the thyroid cartilage. The thyroid cartilage, which is lies at the C4 and C5 levels, and it is act as a shield to protect the larynx from the outside. It has a two lamina. This one is a right lamina and this is a left lamina. It has a pore border, upper border, lower border and posterior border, and this is the anterior borders. It has a two surface, outer surface. This is the outer surface, and you can see the thyroid cartilage from the inside. It is called the inner surface of the thyroid cartilage. So the upper border, which is attached with the hyoid bone by the thyroid membrane, and it is pierced by the internal laryngeal nerve and superior laryngeal artery. Here this level there is a piercing the internal laryngeal nerve and superior laryngeal artery. The lower border which is gives the attachment of the cricothyroid this is the attached to the cricoid cartilage by the cricothyroid membrane, or it is called the cricovocal membrane. And this cricovocal membrane which is attached on the internal side of the cricoid cartilage on the upper side. Here you can see this is a cricovocal membrane, and the most upper part of the cricovocal membrane, it is called the vocal cord. Most upper part of the cricovocal membrane, it is called the vocal cord, and space between the two vocal cord, this space between it is called the Riema Glottids. Riema Glottids. Same way the epiglottic fold, the most lower part of the epiglottic fold, it is called the vestibular fold, and the space between the two vestibular fold, it is called the Riema vestibuli. It is called the Riema vestibuli. So the space between the two vestibular fold, it is called the Riema vestibuli, and the two space between the two vocal fold, it is called the Riema Glottids. And the space in between the Riema vestibuli and Riema Glottids, it is called the sinus of the larynx. And the part above to the vocal fold, it is called the supraglottic part, and the part below to it is called the infraglottic part. The part above to the supraglottic part, which is supplied by the sensory, supplied by the internal laryngeal nerve, and the infraglottic part, it is supplied by the recurrent laryngeal nerve, while all the muscles of the larynx, which is innervated by the recurrent laryngeal nerves. I will show you some intrinsic muscles of the larynx. Here you can see this is the muscles fiber which goes upwards, and it is called the oblique arachnoid. From the base of the one arachnoid cartilage to the tip of the opposite arachnoid cartilage, it is called the oblique arachnoid muscles. And these oblique arachnoid muscles become continuous inside the epiglottic fold. It is called the epiglottic muscles. It is called the epiglottic muscles. And this epiglottic muscles, contraction of the epiglottic muscles inside the epiglottic fold, it lead to there is a epiglottis which close the laryngeal inlet, so during the second stage of deglutitions, the food cannot enter inside the larynx, and it through the oropharynx it comes into the laryngopharynx, and it does not enter inside the larynx by the contraction of the epiglottic muscles. The second muscle, here you can see this is the intrinsic muscles, the fiber which goes upward, this is the oblique arachnoid, and this is the fibers which goes transversely. This fiber, it is called the transverse arachnoid, and it is the transverse arachnoid, and the other fiber inside the epiglottic fold, just lateral to the transverse arachnoid muscles, there are three muscles which lies inside the larynx, intrinsic muscles. The one muscles which is called the lateral cricoarachnoids. This is a lateral cricoarachnoid, and this is a thyroarytenoid, and this is the thyroepiglotticus muscles. So three muscles, thyroepiglotticus muscles, it is the spread inside the epiglottic fold, and another, this is the middle one muscles, it is called the from the thyroid to the arachnoid cartilage, it is called the thyroarachnoid muscles, and from the cricoid cartilage to the arachnoid, it is called the lateral cricoarachnoid muscles. These are the three muscles which is lies inside the on the lateral aspect. So the posteriorly, this is the posterior cricoarachnoid muscles. So the posterior cricoarachnoid, it is called the safety muscles of the larynx, and it abduct the larynx, while the lateral cricoarachnoid muscles, these muscles, lateral cricoarachnoid muscles, mainly it is the adductor of the vocal cord. So, and above to it, there is a muscles, it is called the thyroarachnoid muscles, and this most medial fiber of the thyroarachnoid muscles, it is also called the vocalis muscles. And the upper one, it is the thyroepiglotticus muscle. It is the spread inside the aryepiglottic folds. So inside the aryepiglottic folds, there are two muscles, thyroarachnoids and the aryepiglottic muscles. So thyroepiglotticus and the aryepiglotticus muscles inside the quadrate membranes. And this is the posterior cricoarachnoid. It is called the safety muscles of the larynx. Mainly it is for the abductions of the vocal cord. If there is a paralysis of these muscles on the both the sides, it lead to there is a difficulty in breathing, and it lead to there is a vocal cord which is not abducted and it remain inadducted, and person may be die. The extrinsic muscles of the larynx, mainly the cricothyroid muscles. This is the cricothyroid muscles, which is attached on the outer margin of the cricoid anterior lamina of the outer surface of the cricoid cartilage, and inserted on the lower border of the thyroid cartilage. And these muscles mainly maintains the tone of the vocalis muscles, and if there is a paralysis, it is the extrinsic muscles, and it is the only muscles which is supplied by the external laryngeal nerve inside the larynx. Remaining all the muscles of the larynx which is supplied by the recurrent laryngeal nerves. Another things you have to remember here, this is the Cricovocal membrane. It is the Cricovocal membrane, and most anteriorly this fiber, it makes the cricothyroid ligaments. It makes the anteriorly, it makes the cricothyroid ligaments, and remaining portions which makes the conus elasticus. It makes the conus elasticus, and the cricovocal membrane, it goes upwards, and the most upper fiber, it makes the vocal cord. It makes the vocal cord, and inside the vocal cord there is a vocalis ligament as well as there is a vocalis muscles. So this is about to the larynx. Extrinsic muscles, which is attached to the on the thyroid cartilage on the oblique line, mainly the sternum to the thyroid, sternothyroid, thyroid to the hyoid bone, thyrohyoid, and there is a third muscle. It is the thyroid part of the inferior constrictor, and three muscles which is inserted on the posterior border of the thyroid cartilage. It is the above to downwards palatopharyngeus, salpingopharyngeus, and stylopharyngeus muscles on which is inserted from the inserted on the posterior border of the thyroid cartilage. You have to remember. Now we will discuss about the Riema Glottids. Riema Glottids, it is the narrowest part of the larynx between the two vocal cord. The space between the two vocal cord, it is called the Riema Glottids, and the space between the two vestibular cord, it is called the Riema vestibuli. Now Riema Glottids, which is in front, which is formed by the thyroid posterior side of the angle of the thyroid cartilage. Anteriorly it front, it extend. Behind it is extend up to the interarachnoid fold of the mucous membrane. Here you can see this is the interarachnoid fold of the mucous membrane, and on each side it is formed by the vocal cord. On each side it is formed by the vocal cord, and this on each side it is anterior 3/5 part which is formed by the vocal fold, and the posterior 2/5 part which is formed by the vocal process of the arachnoid cartilage. Posterior 2/5 part which is formed by the 2/5 part of the vocal process of the arachnoid cartilage, anterior 3/5 part of the vocal cord which is formed by the vocal fold itself. So it divides into the Riema Glottids, it divides into the intramembranous and intracartilaginous part. Anterior 3/5 part, it is called the intramembranous part between the two vocal cord, and the posterior 2/5 part which is the between the vocal process of the arachnoid cartilage. So this is about to the Riema Glottids, and it is also called the entry valve. It is act as a phonation for the vibrations of the vocal fold. It lead to there is a production of the voice, and so the shape of the Riema Glottids, it is pentagonal in quiet breathing. During the high pitch voice, it is the linear cheek shape. It is a completely adducted. Full respiration, there is a glottis, the intramembranous part become widened, but the cartilaginous part which is not widened, and it is diamond shape inside the full inspiration. During the whispering, there is a intracartilaginous part which is widening, but the intramembranous part which is remain narrow during the whispering. The mechanism of speech: by expired air from the lung, it is formed by the loudness. Expired from the air from the vocal fold, it lead to there is a loudness, and it lead to there is a vibrations of the vocal cord. So vibrator, it lead to there is a vowels, or it is called the swar. And above to this there is a part of, up to the oral cavity, it is called the resonators. It is the nasopharynx, oropharynx, all this part, it is called the resonator. It quality of the voice which is modified, and there is a articulations, it is called the articulators, or it is called the consonant, and consonant which is produced by the lips, it is called the pa, pha, ba, ba. If it is produced by the labiodental, then ta, tha, da, tha, and it is, if it is lingual, then cha, ja, ja, and if it is palatal, then the ka, kha, ga, ga. So this is about to the Riema Glottids. The arterial supply, which is supplied by the superior laryngeal artery to the larynx, above to the vocal cord, and below to the vocal cord, it is supplied by the inferior thyroid artery. It is the branch of the inferior thyroid artery. Venous drainage by the superior laryngeal veins above into the upper part, and inferior laryngeal veins into the inferior thyroid veins. We already discussed the nerve supply of the larynx, and the lymphatic drainage, mainly the above to the vocal cord into the pre-laryngeal and jugular-digastric lymph node, above to the vocal cord into the pre-laryngeal and jugular-digastric lymph node, below to the vocal cord into the pretracheal and paratracheal lymph nodes. The clinical aspect of the larynx: there is a inflammation of the larynx, it is called the laryngitis, and signal nodules. Misuse of the vocal cord may produce nodules on the vocal cord, mostly at the junction of the anterior 1/3 and posterior 2/3 part. There is a production of the single nodules. Pyriform fossa just lateral to the laryngeal cavity, lateral to the aryepiglottic fold. Aryepiglottic fold, it is the demarcating fold which separates the laryngeal cavity or laryngeal inlet from the piriformis fossa. So this is the piriformis fossa, and this piriformis fossa, it is also called the smuggler fossa. Eventually into the previously there is a smuggler can use this piriformis fossa for the smuggling of the diamonds. So this is about to the clinical aspect. safety muscles of the larynx, it is the posterior cricoarachnoid. This is the safety muscles of the larynx. And cricothyroid, it is the mainly important for the maintaining the tone of the vocal cord. If there is a external laryngeal nerve which is damaged, it lead to there is a paralysis of the cricothyroid, and it lead to there is a weakness of the phonation, and there is it lead to there is a tone of the vocal cord which is not maintained because the external laryngeal nerve which damaged lead to there is a damage to the cricothyroid muscles. Hope you enjoy the lecture. Thank you very much.